Hello, everybody. It's the Helplink show, and Lachlan here, and we are going to have a very interesting show ahead of us. We're going to be talking with Mental Health Ireland and about all the work they do nationwide, and about all the voluntary hubs that they have going, and about the work that they do for schools and education and so much. They've really got so much going on there, and really looking forward to talking with Martin Rogan of Mental Health Ireland. And we're going to be talking with Mental Health Reform, which are a national body with over 70 members. Basically, they are an advocacy body for their members and for the general public to create positive change within mental health in Ireland. So, going to be some very interesting stuff there. And we're also going to be talking to them about their pre-budget submissions to the government around funding for mental health across the island. So it'll be quite interesting to hear what they have to say or what they're hoping the government will do with the budget. Yeah, we're looking forward to that as well. And we might have a piece or two of music too. And yeah, it's going to be a good show, hopefully. And yeah, here we go. So it is the Helplink show, and we have CEO of Mental Health Ireland on the phone with us from Dublin. Thank you very much, Martin Rogan. Thanks for coming on to the Helplink show.
Oh, thanks for the invitation.
Awesome, it's our pleasure. So yeah, just a little bit. I mean, what we do within the Helping Show is we provide information to people, and we try and demystify and destigmatize areas around mental health and emotional well-being, and that is really a huge part of what you guys do as well, isn't it?
Yeah, the Mental Health Ireland, and indeed at a local level, our mental health associations, is a national voluntary organisation, and we've a number of key aims, and one dating back to 1966 when we were founded, is promoting positive mental health and well-being, and also then supporting people in recovery, and that increasingly is in co-production. That means it directly involves people who use services, their family members, and indeed professionals working together in a kind of a three-legged race.
Right.
But we find this is actually a much more efficient way and a more satisfying way for people who use services to be much more involved in their own recovery and plotting a path forward.
I see. So it's not just about creating knowledge and awareness about mental health and positive mental health, but it's actually getting people involved and directly providing some services as well.
Absolutely. And I think originally, I suppose, when the organisation was founded in the 60s, this was a conversation that simply didn't happen, either on radio stations or in media or indeed in polite conversation. Mental health was one of these topics where people covered their mouth and they kind of whispered it, or it was even codified. People use language like, well, he's in boundless low, when they meant a person was in difficulty. So I suppose part of the awareness piece is, okay, now people have a good understanding and an awareness. The question is, well, what do we do to protect our mental health, or to be more engaged and more supporting of people at a time of difficulty in their lives?
Right. And that whole idea of kind of combining with your organization and other organizations and services is something that's coming much more to the fore right now. Because, I mean, at the end of the day, integration instead of doubling up on things is the way to go for people in a small enough island like our own.
Absolutely. I think there was a tendency, I suppose, in mental health circles as well, it was to look inward and to try and provide everything from within. And that model certainly led to a huge institutional base in the past. Where it was really weak was when people had recovered, how did they find a way back into community? And I suppose one of the things we've tried to do is to work with as many agencies as possible, both mental health agencies and non-mental health agencies. So we have relationships with the arts community, with National Concert Hall, with Get Ireland Walking, with Quilcha, with a whole range of different partners, including NUIG, TCD, UL, and a number of colleges across the country as well. And what we're doing is we're bringing a mental health message into the mainstream, but also creating a pathway for people to find their way back into community so they can, pick up again in terms of their college life, their work life, their family life, or engagement with their community.
So you would be engaged quite a lot then, from what I hear you saying there, with the Vision for Change document and about getting things back into the community rather than siloing mental health in itself and down to the individual, but also to the with the services. Yeah.
Yeah, I think the if you think Vision for Change was published in January 2006 and had a 10-year lifespan, so that ran to 2016. Obviously, the recession set things back in terms of many of the ambitions of government at the time simply couldn't be realised in terms of affordability. But huge progress has been made, particularly in Chapter 3 of Vision, around including the service user and indeed family members in designing and evaluating and then now increasingly providing services through recovery colleges and a range of other strategies there as well. And government are about to relaunch a refreshed version of Vision for Change. So it was kind of designed like enabling works. It kind of opened up the picture. And the next understanding of policy is to refine that and say precisely what we want a mental health service to look like and what we want, in terms of the quality of life for the whole population, which is what people would wish for in their lives.
Because quite often, you talk about the whole population there. Quite often, it's seen as the individual. The individual is where the issues might lie. The individual is where they're the one that needs the help and that kind of thing. But oftentimes, it's actually their wider family circle and their friends that also need the support within that. Do you get a lot of people volunteering with you coming from that angle?
Yeah, we attract volunteers from a variety of different backgrounds, both people who are using service currently or people who have recovered, and family members and professionals, and leaders within the community, people from sports backgrounds or educators or Gardaí or a range of backgrounds. And in our strategy we launched last November, which is called Empowerment from Ideas to Action, I suppose what we're trying to do is there is a huge goodwill. There's an extraordinary tide of ambition that people want to be active in this space and not just to be commentators. And we're saying, well, we can help you actually, look at what the needs of your community are and how best as volunteers you can actually act to improve the quality of life. And I think when people think about mental health, sometimes the perception is a little bit skewed. The research would tell us that if we take the whole population and we do an analysis, and some big studies have been done on this internationally, we discovered that about 16% of the population enjoy good mental health. And about 54% have adequate mental health, sufficient to get by, but things can be difficult at times. Maybe about 20% of the population will have a diagnosis and be in active treatment. And then there's a further 10% of people whose lives can be difficult and relationships can be kind of complex and sometimes conflicted, but don't actually have a diagnosis or a treatable condition.
Sure.
And so it's quite a broad spectrum. The really interesting thing about this research is when they returned 10 years later and studied the same people again, they found those same proportions, 16% who are thriving and enjoying good mental health and flourishing, that there's more than half the population who are getting by, 20% in difficulty and in treatment, and that 10% who are often finding life quite a challenge. The fascinating thing is that the membership changed of the groups.
Right.
So simply because you're enjoying good mental health today does not in any way inoculate you. It's just not your turn. And equally, because you are experiencing a mental health need does not mean you're trapped in that world. And that people do progress and move forward and find recovery through a whole variety of different avenues, including treatment and community engagement and a range of other linkages. So it's a much more optimistic picture than we had in the past. There was a tendency to think of a group of people who are known as the mentally ill, and that's not really the reality for most people's experience.
Yeah, exactly. I think we've mentioned that quite a few times on this show, that there's often a lot of statistics out there, let's say 1 in 4 or 1 in 6 or 1 in 8 or whatever it is, will experience something. But when it comes to mental health and good mental health, we all have our ups and downs. No matter what, through your life journey, there will be ups and downs within your mental health, and that concept of mental health is slowly moving away from this hospitalized institution association with the words mental health to being something that's in the general parlance. Yeah,
I think what we're seeing too is people are beginning to understand mental health like your physical health. And while most people say, well, I'm fit, I can do what I need to do, I can get to work, I can walk to school, wherever it might be. But the question is, could you be fitter? Could you be stronger? Could you be, improve your diet? Could you improve, your level of fitness? And I think people need to look at their mental health as a resource. It's a personal resource, and they have individual responsibility, and then we have some shared responsibilities. So we have a responsibility to look out for each other's mental health. And I think internationally we're seeing movement that governments are beginning to understand that they need to design an environment that's supportive of people's mental health. So in terms of everything from the design of cities, we've had meetings with architects and urban planners and a whole range of people around how do we design an environment that's actually conducive and improves people's health. And if you find yourself sitting in traffic for 3 hours a day, that's not good for your mental health. No matter how much mindfulness you do, it's not going to be able to unwind, that 90-minute commute to and from work.
Exactly. Yeah. It's as you say, it's everywhere. It's within our environment. It's within our homes. I mean, how we relate to our own mental health and to others. I mentioned there that you have a lot of volunteers for you. You have 40 hubs, let's say, around the country. That's correct. And then you have volunteers within those hubs. Is that how it works? Or?
So from the beginning of our history, we've had local mental health associations embedded within communities, and so right across the country we have a network of local MHAs, or mental health associations, and they welcome volunteers from all backgrounds and at all life stages. So young people or adults or older persons, people with a lot of life experience, and they are involved in a range of different programs and projects, and they tend to fall into two categories in terms of promoting positive mental health. As you know, October 10, for example, is World Mental Health Day, so internationally is celebrated. And that's really a festival of raising awareness and linking with local partnerships to raise awareness and engagement there. And then also in terms of supporting people in recovery, and that can be a whole range of programs. One of our particularly popular programs at the moment is called Woodlands for Health. It's a partnership with Quilcha, and it's like a 12-week program for people to get back into gentle exercise, get back into the outdoors, have some companionship. And for many people, unfortunately, this can be one of the few social engagements they have in their week. So it really plays against isolation and loneliness, which is really corrosive to a person's mental health.
And because we have such a large rural space and population as well, that can often be a big problem because of that isolation. Also, I mean, yes, for all the will in the world, the internet and Skype and all that kind of stuff can help, but it is not the answer to actually getting out and going for a walk with somebody who wants to be there with you and to be listening near. Well,
I had a phone call from a gentleman. He was a chap in his early 30s, and he had the brand new iPhone. So the new iPhone had, the megapixel camera, and it had various features, and Siri had been improved, and he was able to describe all of the features. And he spoke for about 10 or 15 minutes describing the wonderful technology he had in his hand. But he went on to say, the only problem with this phone is it doesn't ring.
Oh, gosh. Yeah.
Because he had no one who would make contact with him. And he was really craving, because we're all designed, we're gregarious creatures, we're not complete on our own. But for a variety of reasons, he felt he didn't have the skills or the confidence to even begin a conversation. So one of the things we're doing for part of our activity around World Mental Health Day and throughout 2019 and 2020 is what we call conversation cafes. Almost like a speed dating format, but just to bring people together and to celebrate the art of conversation. And it can be really, really powerful and good fun. And oftentimes, even if you're not the most chatty person in the world, even to be party to that, to listen in, to engage and be present, is a really powerful piece.
It can make a big difference. So you have stuff ongoing every year. As you had mentioned there, there's different bits and pieces you do in the local communities of the 40 MHAs that you have. Is part of your work around advocating for other for mental health improvements and that kind of thing, or?
Yep, we certainly make a number of policy submissions in relation to the new policy around mental health, but also around the whole area of the public health alcohol bill as well. We have a partnership with Alcohol Action Ireland. So we look across the broad spectrum, and we engage with a whole series of different government departments and indeed other civic partners as well. And so I say what we're trying to do is move beyond conversation. So the question is, right, that's fascinating, but how does that manifest itself? Where does that happen? Who's responsible for that? Is that properly resourced? And we work very closely, and we have a very good working relationship with the HSE across the country as well.
Right.
So we would have a team of development officers who support our volunteers in each area, and we also support a number of recovery colleges, which provide a whole syllabus of very useful pragmatic tools, and it can be everything from sleep hygiene to understanding mental health issues to supporting family members, a whole range of different evidence-based pieces. And this, I suppose, has been the big shift in the recent years, is that the conversation has become a little bit more sophisticated. So it's not just simply, eat 5 pieces of fruit and vegetable a day, but why are we doing that? What's the understanding of that? What actually works? And what are the kind of strategies that people can integrate into their ordinary everyday rather than making a special effort? And these are much more effective. So we've actually just instituted this year a partnership with Margaret Barry at the School of Mental Health Promotion in NUIG. So we've now developed the world's first senior program, almost at master's level, level 9, in mental health promotion. So it's just a scientific core to this.
Excellent.
But it's important that it translates and it doesn't become a lab-based exercise, but it's something that lives and is active within your own community.
And that has just started this semester, is it?
The first intake just began there at the end of September,
Excellent.
and it's a 12-month program, and it's heavily delivered online and in Galway and NUIG. And Professor Barry is internationally recognised as a world leader in mental health promotion.
Yeah, definitely. You've mentioned recovery colleges a couple of times there as well. That's a fairly new thing in around Ireland. What is a recovery college? Because a lot of listeners out there maybe mightn't know very much about those things.
Sure. Well, if I look at my own experience, my background's in mental health nursing. I began my nursing career 36 years ago. And my experience was based on other professionals and textbooks and learning and syllabus, etc. But I don't think we fully appreciated the importance and the value of lived experience. So for an individual who has experienced significant mental health issues, that might be severe depression, bipolar, schizophrenic conditions, other psychotic illnesses, eating disorder, etc., there is a depth of knowledge and a credibility that I, as a professional, I can complement that, but I can't replace that. And we also recognize, too, that family members have developed an expertise, sometimes by exploring strategies that were unsuccessful, and they said, well, that didn't work for me. But it's also making sure that people have like a utility belt of skill sets.
Right.
In fact, sometimes what we call mental illness is when a person uses their favorite coping strategy over and over and over again to exhaustion, but it's still not successful.
Right.
So in recovery colleges, people with self-experience and others come together, work through a syllabus and say, well, what do you need to know? What would be useful? What's helpful? And that can be very pragmatic things about entitlements and benefits. It might be around various treatment options. It might be about an understanding of mental health legislation. It might be around useful skills if you're feeling low, how to build up your mood, how to get a good night's sleep, what's a good diet if you're coming out of a depression, for example, and also the local resources that are available within your community. And increasingly we're encouraging people not just to depend on the mental health service, that's one aspect of your care and treatment, but there's a much richer tapestry of options outside of that. So there has been a tendency in the past for people to almost identify with and define themselves by a diagnosis.
Right.
And almost sit passively waiting for the diagnosis to lift so they can unrelease the pause button and get back into the mainstream. More and more we're encouraging people to say, stay as active and engaged as you can.
Yeah.
And of course there's going to be times when that's going to be just, so difficult as to be impossible. But don't give up on that, because that's where your life is.
Okay.
And that's the piece you need to hold on to.
And these recovery colleges, they're kind of spaced out around the country, are they?
Yeah, they have developed somewhat organically, and certainly in the west of Ireland, in Mayo, for example, one of the first recovery colleges in Ireland emerged. And this was often based around really insightful and innovative individuals. But now we're seeing colleges appearing right across the country, and rather than waiting for that to evolve naturally, one of our roles at MHI is to say, well, there's an area here where people really need this service, but it hasn't just spontaneously happened here.
Okay.
One of the programs, and this is happening usually in community-based context, but we've been very pleased to work with even the National Forensic Hospital at Dundrum, so that people who are in that hospital have the same level of access as if they were living in their own community. And they set up the Evolve Recovery College there in April 2018. And to date, they've delivered over 700 courses to people at the National Forensic Hospital. And that has been replicated in the Midwest, in the West, in the Southeast, in North Dublin, right across the country. And we're basically moving stepwise through the country to make sure anybody who uses mental health service, or indeed their family members, or indeed members of the wider community, can engage and involve themselves with a recovery college.
Brilliant stuff. It's fantastic stuff. You have a lot of those research. You mentioned a paper, a policy that you put out last September. Are those papers and other information are available on the website?
Yeah. We're actually just recently relaunched our website and refreshed because we had so much material on it. It was difficult sometimes to find.
Okay.
So if people visit www.mentalhealthireland.ie or just Google Mental Health Ireland, it will pop up. And there's a range of resources there, and we're also very active on Twitter, on Facebook, and on Instagram as well. So we're hard to avoid online.
Great.
And we've a great following, actually. Each year we have an event here at our head office for our virtual volunteers. And we have some extraordinary people who've put up, really heartfelt material in terms of their own experience. And we really appreciate that because it makes it very real and tangible. This is not, an esoteric thing. This is about real people and their real lives.
Yeah. Like we were talking about at the very start. Like, this is a lived experience for most people. At some stage in their lives, they'll have some sort of an issue that they'll need to maybe get some support with. And if people want to volunteer, there's also I can just let them look at the website here. There's a get involved section there, so you can go there and see if you can get involved in your local community. Is there anything coming up in the next couple of months before the end of the year that you'd like to tell the listeners about that's happening?
Well, I think one of the things to look out for is our conversation cafes. And these will be held in local areas, being hosted by local mental health associations. For World Mental Health Day at the Mansion House in Dublin, we're having a national event, but right across the country. We also have some celebrations of mental health in a number of cities and towns. In partnership, for example, in Limerick, we have 32 different partners within the community that we link with to again bring mental health out beyond the walls and out into a better picture. And we're also on our website. We've commissioned a number of new videos. We sometimes find, for example, that the public image of mental health, and this is sometimes not helped by the media, using old stock footage of old asylums. In a previous role I had when I worked with HSE in the past, we worked with staff, with services, with families, and with new resource from government to move away from the old institutional models. The most recent unit opened in Ireland is the new acute unit at UCHG in Galway. And it's a very different image than what people often imagine with remote buildings removed from the town, high walls. That is firmly in our past, not to be forgotten, but is no longer the case. And oftentimes that image discourages people who are in difficulty from seeking help. And I suppose we like to remind people that GPs are the first point of call if a person is feeling difficult or feel that they're becoming overwhelmed or they're concerned about a family member. 35% of all GP visits in Ireland, that's 6 million visits every year, relate to a mental health need.
Gosh. Wow.
And GPs, 90% of people don't go beyond their GP. The GP, sometimes with their primary care team or sometimes on their own, can successfully work with the individual to manage that. And if they need some additional guidance, they will usually refer people to the community-based services. And again, of that 10% of people that are referred on, 90% of that group would receive their service within the community, within a day hospital, within a local primary care centre. Much, much smaller numbers of people are admitted to hospital than we would have seen in the past.
Yeah, which is a great thing because, the key the key to recovery and progression is everybody wrapping themselves around the individual when they need it, when they want it, and to progress that way instead of isolating people.
Yeah, and it's important to not to crowd the person out.
Yes.
Because the person will find solutions that work best for them. They may occasionally go up and down some cul-de-sacs, and this is why it's really important that people would mobilize early, rather than when things become difficult, when relationships become strained, perhaps becoming alienated from people who would naturally be close to them and care for them. And there's a number of programs. For example, with Mental Health Ireland, we have a relationship with UCC. We developed a program called Mental Health in the Community.
Okay.
There's a program at DCU around building leadership skills in this space as well.
Yeah.
And now our new partnership with NUIG.
Yeah.
And for people who use mental health service and family members, if they need some assistance with that, we have what we call our Tony Leahy Scholarship. Okay. So MHI can pay up to half of the fees for eligible people who'd like to embark on these programs. So we're just trying to remove any barriers that might get in the way, that might discourage people from learning more, understanding more, and adapting different strategies in their lives that can protect and promote mental health.
Excellent. So keep an eye out on social media for the conversation cafes that'll be coming up. And Martin, thank you so much for coming on the show. I really appreciate that, and I've learned a lot today about what you guys do, and hopefully a lot more people will be able to access the information now and maybe take part in some. Well, now we have on the show, we have Kate Mitchell, who is the Senior Policy and Research Officer with Mental Health Reform. Hi, Kate, and thanks for coming on.
Hi, Lachlan. Thanks for inviting me on.
Oh, it's my pleasure. And just from the outset, to let all the listeners know, I am actually one of the volunteer trustees with Mental Health Reform, so I would know Kate and through the past while, and know a little bit about the organisation and what's going on. Well, know a lot about the organisation, what's going on. But basically, I wanted to have you guys on to maybe to provide information about exactly what mental health reform is and what's currently going on for you. So why was mental health reform set up? What's its reason for being, let's say?
Yeah, well, mental health reform it came about through Amnesty International's campaign on mental health in the early 90s, and they were doing a lot of work at that time looking at human rights of people with mental health difficulties and those engaged with the mental health services in Ireland. And through that campaign, it was really identified that there was a need for an umbrella mental health organisation or a coalition on mental health that would really look to advocate for better mental health services and supports across the country and drive reform of our mental health system.
Yeah.
So Amnesty International were one of the co-founding organisations, along with the Irish Advocacy Network, Bodywise, Grow, and we started very small. We were a coalition of 5 member organisations and set up in 2006.
Okay. Around
the same time as our current National Mental Health Policy, Vision for Change, was published. And our remit at that stage was really to advocate for implementation of that policy. Okay. And since then, we've grown a lot. Now we're almost 80 member organisations, and we have a wider remit in terms of advocating for better mental health services and support across a whole range of sectors, not just in specialist mental health services, but in education, employment, housing, and so on.
Right. So right across the board. Can you just go back one step there and just explain a little bit about the Vision for Change document and what its purpose was? And
Sure. So there was an oversight group, people with experience, expertise in mental health, that were appointed to to look at developing this national mental health policy, which we know is a vision for change. And in some ways, the policy wasn't, radically transformative. The previous national mental health policy, Planning for the Future, had already identified that there really needed to be that move from institutional mental health service provision to community and mental health service provision. But in other ways, A Vision for Change was very transformative and was a really positive policy document. And it looked at areas that really hadn't been identified before, like mental health promotion and mental health at all stages in someone's life, from early years right through to older age. It had a massive focus on recovery, or what we call the recovery ethos, whereby, we talk about someone having their own personal recovery, and that's very personal to them. But when we talk about recovery-orientated mental health services, we're talking about services being hopeful towards the person. We're talking about people having choice in terms of their own care and treatment. We're talking about people being partners in their own care. And the Vision for Change is really strong on that. And the principles underpinning the policy were very much focused on people being involved and in being partners in their own mental health care and treatment.
By partners, you kind of mean like they're actually included in the process of from diagnosis to treatment. Exactly. They know what's going on, essentially.
Exactly. So at a very individual level, that they have a care recovery plan. They're involved about decisions about their own care and treatment. And they're involved in decisions about the medications that they're taking, but also at a systems level in terms of the design, development, delivery of mental health services, that people who use the services are also involved in that process.
And you guys got involved in that very much so last year with the questionnaire you had going out. You were looking for patient input, wasn't that right? Was that last year?
Yes. So I suppose just to clarify that there has been a process where a group has been appointed, an oversight group that's been tasked with reviewing the existing mental health policy, and we're expecting that to be published later this year. But Mental Health Reform was one of the organisations that sat on that oversight group. So we have been involved in that process. But we also carried out another piece of research. It was our My Voice Matters national consultation, and we published the findings of that earlier this year in March 2019. And what that consultation really sought to do was to gather the views of people who have experience with the mental health services, those who have actually been engaged with the services, but also with family members, carers, supporters. And we did that through 2 surveys. And we asked people a whole load of questions from their experience in mental health and primary care, and the kind of support that they got from their GPs, right through to experiences of community mental health services, if they'd been in hospital for mental health care and treatment, to crisis mental health support, and the extent to which they felt that the services they had been engaged with were recovery orientated or recovery focused. So we had a really good response rate to those surveys. We had about 1,200 people who had used services in the last 2 years, and almost 800 family members and supporters. So those findings are published, and we're in a process now of really disseminating those findings and advocating for implementation of the recommendations in our report. Some of those findings were quite stark, and what we found was that many of the participants reported that they weren't involved in decisions about their medications as much as that they would like. They didn't feel as listened to as they would like by the mental health staff. that they didn't have, many reported that they didn't have an individual care recovery plan, that they didn't have a key worker. So we have recommended very practical measures. They're not radical, they're very much in line with existing mental health policy, with existing guidance, existing regulations, that our findings show could improve the experiences of people who use the services if people have things like a dedicated key worker, if they're able to develop a consistent relationship with a consultant psychiatrist over time, if they have a care recovery plan, that can improve their experiences.
Interesting, very, very interesting. And all that information is available on the website and the research. And it's mentalhealthreform.ie.
It is, yeah, at mentalhealthreform.ie, and we're very happy to talk to people if people want to pick up the phone and give us a call or send us an email. We're always very happy to engage with people around the findings if they have any thoughts or comments.
Okay. So you mentioned earlier on there that there is currently a working group going on for the next iteration of the Vision for Change. Do you know when that might be due out, or
I don't, Lachlan. Unfortunately, I don't know when it is due out. We are expecting that hopefully the revised policy or reports of the oversight group will be published before Christmas, but I wouldn't be able to give you any further insight around that.
No problem at all. So watch this space, as they say.
Exactly, that's it.
And we'll go back a little bit to mental health reform itself then as well. And so you were saying there's over 80 member organisations. Are they generally all mental health, like charities and organisations, or?
Yeah, so we have almost 80 member organisations, and some of those organisations would be the big national mental health groups that many people would be aware of, like the Samaritans, like the Youth Mental Health Services, Grow, Shine, Mental Health Ireland. But we also have many organisations that, while they're not mental health specific, they're coming across mental health, they're coming across mental health difficulties in the work that they're doing all the time. Right. So, for example, a lot of the homelessness and housing organisations would be members of ours, because of course mental health difficulties is hugely prevalent amongst the homeless population. So they're seeing this and experiencing this all the time. We would also have members from the disability sector, child and youth sector, general advocacy sector like Children's Rights Alliance. So there's a very wide range of knowledge and expertise amongst our membership that is really valuable in terms of us advocating for change and seeking reform of the mental health system in Ireland.
Right, so they all kind of feedback in one way or another. There's this constant kind of feedback going on between the members and yourselves, looking at what you want to study and research and look at.
Absolutely. So we would have a few key areas of work, one of which would be our coordination and policy development, and as part of that, we will consult with our members on development of any new policy positions or recommendations. So they're very much engaged in terms of what we advocate for and what we call on government to take action on.
Okay, excellent. And every year, then, to my knowledge, you guys do a pre-budget submission or something around the budget to try and influence the government on how they will spend within mental health. Is that the same this year? Or?
Yes, absolutely, and really important part of our work that we do call on government to invest in mental health each year and to adequately invest in mental health, and this year is no different. Mental health reform is calling for increased funding in mental health for budget 2020, and it's so important that the government address the ongoing and significant gaps in mental health services and supports across the country. And we can see this very clearly, for example, in the long waiting times for children and young people accessing
Yeah.
CAMS, Specialist Child and Adolescent Mental Health Services. We currently have about 2,500 children waiting to access CAMS for the first time, and 10% of those are waiting more than a year to be seen. Similarly, we can see it in the long waiting list for primary care psychology. We have about 8,000 people waiting on lists for primary care psychology, about a quarter of which are waiting more than a year.
Wow.
And many of those people are children and young people under the age of 18. And so it's so important that we see that investment, and it's really important that it involves investment to sustain services that are currently provided, just to keep things ticking over as they are, but also to develop new mental health services, which are so badly needed. Because we do have so many gaps in mental health services and support in Ireland. And, if this investment is not made, then the gaps in services will be bigger next year and again the year after that. So we have some very specific asks for government.
Right.
And we're asking them to invest an additional 100 million in mental health services in budget 2020, and we're calling on them to use it to increase mental health staff levels, because staffing levels are so low, to develop out-of-hours services.
Isn't there like an issue that there's money there for staff, but they can't employ the staff, or they can't find the staff? Is that currently an issue?
Yeah, there have been long-standing issues in terms of recruitment of staff, and there have been actions by HSE to recruit staff in mental health services, including international campaigns. But it's really difficult to get people in posts, and that's attributed to a number of reasons. Often it's very difficult to compete with other international jurisdictions where pay may be better, where teams are more adequately resourced, facilities are much better. There's much better opportunities in terms of promotions and progressing in professional careers. So there's that to contend with, but I would say that there's also been quite a large focus on recruitment of medical staff too, and we need to look at recruitment of other disciplines,
so right
like
across the board,
psychologists and occupational therapists, social workers, because we can see from the numbers that there are significant deficits in terms of numbers of allied health and social care workers in the services, in comparison to what our national mental health policy sets out. So we really need to bring those numbers up, and I think there needs to be more of a concerted effort to recruit these disciplines.
Okay. You mentioned earlier there about the 7-day week as well. I mean, one of the things within Helplink itself is, and why it was set up, was to create accessibility and to have services, mental health services, basically, available for people when they actually need them and they're able to get them. And that you actually ran a campaign. Was it last year or as well, around 7-day a week access?
We did, So we, first of all, we ran a campaign on the need for 7-day week services for adults. So extended service in adult community mental health services. And this year we had a very successful outcome in that the Minister for Mental Health made a commitment to roll out 7-day a week services in adult community mental health teams. So wherever they didn't exist, they would ensure that service was put in place.
Excellent.
So that is currently in progress. And we're monitoring that. We're keeping a very close eye on that. But this year we have focused on the need for 7-day week services for children and young people. So again, extending hours of services of CAMS services. And that is in train. So any support that we can get people who are listening to contact their local TDs, centres in their local communities to repost or retweet what mental health reform is putting up, that would be really greatly appreciated, because we need all the support we can to try and achieve that. And that really that's the first step. And ultimately there is a need for 24/7 community responses. to ensure that when someone is in mental health crisis, that they can get the help and support that they need. Because we know often the only option that people have is to go to an A&E department, which is not an appropriate environment. It's often very chaotic, and people often have to wait very, very long hours to be seen. And some people then end up leaving before they get seen, and sometimes very tragically that results in very tragic consequences.
Yeah, well, we have had quite a few of those unfortunate circumstances in Galway in the past and this year as well. It's crucial. So just for the listeners out there, as Kate was saying, if you guys can get involved, I mean, sometimes people feel like, oh, how can I get involved in something like this? I don't have that much time or whatever. But what you could do is you could simply go onto their Twitter pages or their Facebook page of Mental Health Reform and retweet their the messages they're putting up there around this topic. Very simple actions of that can help everybody. Sorry for interrupting you there, but Kate, I just think it's important that the listeners know that's a great way to help out, and a really easy way to help out as well.
Yeah, that would be really great.
Okay, and so for this year, you're looking at 100 extra in the budget.
100 extra. So I suppose just to clarify for listeners that in recent years there's been on approximately 1 billion invested in mental health, and that funding is used to really keep things ticking over and to pay staff and so on. But there is a need for some additional funding to develop new mental health services, and also to cover the costs that just simply come from increased costs associated with just keeping things ticking over the way they are. So we are asking for 100 million in mental health services, and as I said, that would be used to increase mental health staff levels, to develop out-of-hours crisis services for children and young people, to provide more counselling and primary care, and to provide advocacy services to all children, young people and adults engaged in mental health services across the country, because there are significant gaps in that area. But also to invest in community and voluntary organisations that provide really essential mental health services and supports in communities. We'd also like to see investment in housing supports for people with severe and enduring mental health difficulties, and also mental health and education. And then finally, to provide funding to develop mental health supports in the Irish prison system, because we know that there is significant mental health needs within the prison settings. So they're really our key asks, and our campaign has been up and running now a couple of weeks. So we'll be doing everything we can to raise awareness of those asks, and to ensure that mental health is a priority in Budget 2020. And again, anything that listeners can do to support that in terms of retweeting, reposting, contacting their local TDs would be really appreciated.
Yeah, exactly. Because, I mean, as correct me if I'm wrong on this, but we're still not at the level of percentage budget-wise that we were in the 80s when it came to mental health.
No, absolutely not. In recent years, we're at about 6%. We've been at about 6% of the total health budget. And that's very low in terms of when you look at other better performing countries like the UK, Sweden, Netherlands, France, Germany, who are actually investing about 10 to 13% of their health budget in mental health. And we're not in compliance with our own national standards on this. Our current mental health policy had recommended that we invest upwards of 8% of our health budget in mental health. We've been at 6% for the last few years. Sláinte Care, which sets out the vision for healthcare in Ireland for the next number of years, has actually recommended 10%. So at 6%, we're too low.
Yes, definitely. And with the increased amount of referrals and diagnoses as well. Like for example, there's a massive increase with anxiety in children and young people, and you just really need to have the background infrastructure to help with that. And ways of doing that are, yes, one with money, and the other is by changing the access to the system. Yeah, definitely.
Absolutely, and we can see that demand on the services is increasing. Demand on CAMS has increased by about 40% between 2011 and 2016.
Yeah.
So the demand on the services is increasing, and in order to not only develop our services, but to just keep them ticking over as is, we need to see that investment happening.
Exactly. Okay, well, so great. So is there anything else actually you want to talk about from mental health reform, maybe in the next couple of months besides the budget that you guys are doing? Or like, I think, are you doing any fundraising initiatives or anything like that you want to mention?
The only other thing I would mention, Lachlan, is that we also have a campaign on reforming our mental health legislation.
Okay.
So our current Mental Health Act 2001 is very outdated. It doesn't adequately protect the rights of people, both adults and children, who go into hospital for mental health treatment and care. And we've been seeking full reform of the legislation for some time now. And the draft legislation to reform the Act has been sent by the Department of Health to the Mental Health Commission for their review, and it's expected that that will take a few months. But certainly, we would like to see that reforming legislation published as soon as possible. It has to be a priority in terms of adequately protecting the rights of people with mental health difficulties. So we will be doing a lot of tweeting and posting around that as well, and have information up on our website. So if people are interested in that, I'd really encourage them just to follow our work on social media and on our site. And it'd be great if people could get involved.
What are those handles then for Twitter and Facebook and maybe Instagram you have as well? I'm not too sure. What are the handles like? Just mental health reform on Twitter and they'll find you, kind of thing, is it?
Exactly. Sorry, I know I should know this off by
heart,
but I don't.
No problem at all. Just so everybody, just have a quick Google and you'll find them on there, or whatever other browser you're using.
Sorry about that.
No, it's you're grand. Well, mentalhealthreform.ie anyway is the website, and there's links from the social media on the website as far as I'm aware as well from that. So listen, thank you so much, Kate, for coming on. It's been very enlightening, and wish you best of luck with the budget proposal and the other research that you guys are doing.
Thanks a million. Thanks so much.
Thanks for the work yourselves. Okay, so what do you think of that? Very interesting stuff there. A lot going on for both those organizations, and if you can support them, please go onto their website and their social media and give them some support, or even just talk about what they do. It's brilliant. So we're looking forward to hopefully some great changes over the next while when it comes to mental health, and also some more reducing of the stigma, which would be great. And thank you very much for listening. And we're going to finish up now. But I just want to thank you all for listening to the show, and just to say we really appreciate it. And I hope that the information that we provide you every month is helpful to you. If you have any questions or you have anything that you want our counsellors in Helplink Support Services to answer anonymously, just send an email into us at helplinksupport@helplink.ie. And we will get our counsellors to look at it, and I'll give you the answer to your question on the next show, if that's something you'd like to do. Otherwise, please go to our website anyway, helplink.ie. We support people 7 days a week and out of hours with counselling services, both online nationwide and locally in the west of Ireland. I have some really good news as well. We're going to be opening up a new office in Mayo, in Kilchima, in November. So very interesting stuff there. We're going to be providing all our face-to-face 7-day-a-week services in Mayo now, as well as in Galway. And as I was saying in the last show, we are providing our school workshops, emotional well-being workshops for primary schools and post-primary schools in Dublin, in Mayo, and in Galway this year. So very much looking forward to that. And if you have any questions at any time, of course, give us a call to the charitable organisation that is Helplink Support Services. And this is the Helplink Show, and thank you for listening. And don't forget, keep your head up.